So we are looking at now challenges and opportunities. So this is an event which just happened yesterday. I took the clipping from Times of India, where India surpassed the WHO guidelines. So a lot of you who are from the industry know we have a WHO guidelines which say that we require at least one doctor for 1,000 patients. And the happy news is that India just surpassed that guideline, saying that now we have one doctor for 900 patients. Obviously, this is not an ideal scenario, but that is the minimum, bare minimum guidelines which are set by the World Health Organization, and the parliamentary standing committee person said that we have crossed it. So that shows that we are having more healthcare professionals, which is great, and more and more people want to become doctors and enter the healthcare to serve the population in India, which is awesome. So that's one great thing or positive thing to celebrate. But the other hand, you see another clipping which is there from Knight Frank, which is a research agency again, about hospital beds. That ideally the bare minimum should be 3 beds for 1,000 people. Like we have one doctor for 1,000 people, 3 beds for 1,000 people. And India sorely has a large gap. 24 lakh beds are missing or less. And out of which they have also given our distinction, like we already know 60% is private and 40% is public. So about 45,000 private hospitals and 26,000 public hospitals. But we have 24 lakhs less beds. That means you can imagine the dearth of opportunity or challenge, you can take it either way, which exists in this sector. So you require more beds, and more beds means more doctors and more patients. So it's like a continuum where doctor and beds or doctor and hospitals are required more and more. As you already know, in metros, we still have, I would say, decent amount of coverage in terms of beds in hospitals. But when you go to tier 2, tier 3 cities in rural India, the problem becomes much more acute, and which the government is also trying to address. So that's one challenge, or giving you a very, I would say, top down view of how the industry is there today in terms of the basic providers and the beds available. But also a little deep dive into the industry itself. You will also encounter this in the course if you are doing the course master, that we like there's a Indian healthcare market. If I look at from the industry perspective, medtech pharma improving at 17% annual growth, which is a very healthy annual growth, while the rest of the world is seeing slow down when we are growing. The government focus is to provide access and affordability, that is access via telemedicine, via remote patient facilities, and digitization, because if your records are digitized, you don't have to carry the entire file systems with you. You can easily carry it in your app on your mobile phone, and that will be there forever. And it's very easy for you to compare records, whether even when you're going out of India. Next would be healthcare infrastructure development. So a lot of hospitals are being added, beds are being added, both by private and by government. So government obviously lesser, but they are trying to do a public-private partnership with private providers, where they are giving the land and the private providers are going to develop it and to make a large-scale hospital. So that's one very, very important thing, and especially required in your tier 2, tier 3 cities. The next trend we don't talk about are the disease burden the same as before. So as we see, the NCDs or the non-communicable diseases are on the rise, like diabetes, cancer care, respiratory disorders. So what does it mean for us? So as healthcare professionals, we know that we have people who will require long-term care. If I take COVID out of the equation, because that was an infective disorder and it was a pandemic globally affecting, the other burdens, if you see today in your hospitals, are people coming for diabetic care, for their cancer treatments, and who are in remission, then again coming for checkups and follow-ups, people with respiratory disorders, chronic inflammatory disorders like arthritis, or even like or disorders like PCOS, which are long-term patients. So you require systems which can help them not only tackle this problem from uh, illness to wellness lens, but also psychologically allied healthcare professionals will be required, and long-term care will be required. So that will help you understand what kind of design or operations you need to do looking at the disease burden today. Then if you want long-term care, you also need money for that. So you require healthcare insurance. All right. So Ayushman Bharat and different private insurance schemes. I was happy to see that there was an article saying that now private insurance is also covering dental in some of the cases and OPD in some of very few cases. I'm also on the advisory board of one of the startups which works on OPD insurance. So that's one neglected area and much needed area, because most of us don't get admitted and take care of our health. We are outpatients, and we still want some insurance to cover our expenses. So that's another area where you can do a lot of work on. The focus is obviously on preventive care like healthcare screenings, vaccination programs, lifestyle modification. I would use shout out to the NGOs who are doing great work in breast cancer screening, cervical cancer screening, because screening is the first step to the early diagnosis and then prevention. So that's another avenue where you can be part of that non-profit ecosystem and contribute to healthcare. Lastly, like I said, that on regulatory side, the headwinds are there from the government to standardize care, or SOC as we call it, standard of care practices across the country, where you have the Clinical Establishment Act, and recently the government also came up with guidelines of how to interact with doctors for the industry. And government is allowing 100% foreign investment for to allow medical device manufacturing units to be set up in India under Atmanirbhar Bharat, and then greenfield projects where they are giving an impetus on more hospital beds, etc. So we had that deficit slide here where the hospital beds were less, etc. And here we have FDI being allowed for the government by the government to foreign companies, or even anyone who wants to invest in Indian healthcare to set up manufacturing facilities, hospital and pharma projects in India itself. Lastly, if there's so much of demand, we require healthcare professionals. We require them to be upskilled. They require uptraining and upskilling programs, medical education, and enhanced skills for healthcare. So there are a lot of foundations, non-profits, even academies doing excellent work to upskill healthcare workers and then make them more suited for the industries. Lastly, there's the startups, which are the innovators in the country, are doing innovative work on remote patient monitoring, point of care diagnostic, digital therapeutics. And these are the key trends if you look at throughout the healthcare, which is giving the headwinds there. So your big data analytics are on the top because of the burgeoning of the data we are gathering in healthcare, and how IT and analytics can help us make sense of the data. Robotics, wearable technologies, where everyone, I think a lot of us have smart watches or trackers on the phone, where we are calculating our footsteps, our calorie count, taking photographs of our food and knowing how many calories are we consuming. So all of that is going into your wearable tech. And then obviously the discovery of new drugs, new devices, new therapies. So these are the trends or opportunities which are existing in the healthcare industry.